Sweat chloride test for cystic fibrosis. Do you know about cystic fibrosis? Cystic fibrosis is an autosomal recessive disorder that involves mutation in the cystic fibrosis transmembrane conductance regulator CFTR gene. The mutation occurs in the CFTR gene causes dysfunction of CFTR proteins, which led to reduction of chloride transport in the body. This condition may also result in several clinical significance. Symptoms of cystic fibrosis. First, patients with cystic fibrosis will have very salty tasting skin due to abnormality in electrolyte transport from the sweat gland. Second, mucus also can clog up respiratory airways and trap germs that can lead to difficulty breathing, frequent coughing, and frequent lung infection. Next, due to accumulation of the mucus in the pancreas, the digestive enzyme is unable to be produced and nutrients cannot be absorbed, thus lead to malnutrition and poor growth. It also causes the stool becoming bulky and greasy appearance due to poor digestion of fats. Other than that, blockage of tubes connecting testes and prostate gland can also cause infertility in men. Next, we will move to the principle of sweat chloride test. Sweat chloride test is used to measure the amount of chloride present in patient sweat by using reverse pilocarpine iontophoresis method. Reverse iontophoresis method uses electrical current to stimulate the sweat gland in order to ensure patient body able to release sufficient amount of sweat from their body for further testing. For sample collection, first and foremost, after the patient's arm is being cleaned, pilocarpine and mild electrical current has been placed on the small area of the arm and leg. This mild electrical current makes the pilocarpine seep into skin and stimulate the sweat gland to produce sweat on the skin. During this period, the patient may feel a little tingling or warm and it lasts about 5 minutes. Next, after removing the electrode, the healthcare provider will collect the sweat by using a plastic coin, a gauze pad, or a piece of paper that is taped on the forearm. Sweat being collected for 30 minutes. The collected sweat is then sent to a hospital laboratory to measure how much chloride is in the sweat. For sweat analysis, there are two methods that are most frequently used. First is chloride concentration, where sweat chloride analysis is recommended as a cystic fibrosis diagnostic test. Second is conductivity measurement, where sweat conductivity can be utilized to screen for cystic fibrosis. The conductivity sweat test is a simpler sweat test method that eliminates the weighing and dilution steps and also reduces the risk of sample evaporation. Sweat analysis can also be done in two different ways. First, an indirect method based on physical-chemical properties of ions or solutes in sweat, such as conductivity and osmolality. Indirect method is to investigate whether analytical methods based on the qualitative physical-chemical properties of ions or solute in sweat are less effective than the specific measurement of electrolytes in the diagnosis of cystic fibrosis. Second is direct measurement, such as the measurement of the electrolytes chloride and sodium. Next, we will move to the laboratory findings. This is reference range for sweat chloride test. For chloride levels more than 60 mmol per liter, it indicates that cystic fibrosis is likely as the level of chloride is high in sweat. This condition happens due to deficient or absent of CFTR function cause the CFTR chloride channel defective. Therefore, chloride cannot be reabsorbed into sweat duct cells, cause abnormal chloride transport across the chloride channels. When the results obtained showed that the chloride level is between 30 to 59 mmol per liter, further testing is required. Intermediate or borderline result means that cystic fibrosis is possible. Individuals have risk of developing cystic fibrosis or have cystic fibrosis. Thus, they require CFTR gene testing. Besides that, sweat tests might also be repeated. If the results obtained showed that the chloride level is low, cystic fibrosis is unlikely present. However, for newborn with positive newborn screening, intermediate or negative sweat testing receive diagnosed other than cystic fibrosis, which is CRMS or CFS-PID. Therefore, infants should be seen by a CF specialist at least twice in their first year of life. In conclusion, sweat test is considered to be gold standard method for diagnosing cystic fibrosis. There are some advantages and disadvantages of sweat test. The advantage of this test is it provides reliable and accurate result and produce rapid result compared to other method. The disadvantage of this test is this test unable to measure the severity of cystic fibrosis in patient body.